I'm about to tell you something that might make you angry, and honestly, it should. In my experience, reviewing hundreds of CMP exam reports for lumbosacral strain specifically, I found that usually about 7 out of 10 examiners skip the most critical and important sections of the DBQ or disability benefits questionnaire. The sections specifically designed to capture your functional limitations during flare ups and after repeated use over time. These aren't optional sections. The VA requires examiners to complete them, but most don't. And when they don't, you walk out with a 10% rating when you should have gotten 20% or maybe 40%. Here's what you probably don't know. The examiner you're seeing might be seeing 15 to 20 veterans just that day. They are rushed. They're following a checklist. And unless you know what they're supposed to ask, they'll skip right over the questions that could double or triple your rating. But that's why you're here today, because I'm going to walk you through exactly what happens during a CMP exam for lumbosacral strain. From the moment you walk in to the moment you leave, every question they should ask, every test they should perform, and most importantly, the exact words you need to say to make sure they don't skip the critical sections. All right? Listen, what do I know? I'm Dr. Marshall Barr. I'm the founder of Xterra Health. And as a physician who has reviewed countless of CMP exams and DBQs, I know exactly what a complete exam looks like. And I'm going to show you how that looks like. Let me give you some context. Your CMP exam, or the compensation and pension exam, is the single most important factor in determining your VA disability rating for lumbosacral strain. Not your pain level, not how long you've been hurting, not even your medical records. It's your CMP exam. Because here's what happens. You file your claim. The VA reviews it. They say, we need more information. They schedule you for that CMP exam. That exam gets assigned to a contracted examiner. I mean, it could be a physician, could be a nurse practitioner, could even be a physician's assistant. Doesn't matter. It's a credentialed provider. That examiner usually spends maybe 20 to 45 minutes with you, fills out the DBQ, and sends it back to the VA. The VA rater then uses that exam to determine your rating, not your private doctor's opinion, not your own statement, not a next letter. It is the CMP exam and the DBQ. So if that exam is incomplete, if the examiner doesn't ask you the right questions, if they don't test you properly, you're done. Your rating will be based on an inadequate exam. And here's the brutal truth. Most CMP examiners are not bad people. They're not out trying to screw you over. Honestly, they're just overwhelmed, maybe undertrained on the DBQ requirements, and they're usually moving too fast. Let me tell you about a veteran I worked with. I'm going to call him Mike. See, Mike had severe lumbosacral strain from years of carrying heavy gear as an infantry marine. He went to a CMP exam. The examiner tested his range of motion. They measured a 65-degree forward flexion, and they wrote it down. Exam over. 15 minutes total. Mike got a 10% rating, which is $171 per month. Mike was devastated. He came to me. I reviewed the DBQ. The examiner had left sections 3C and 3D completely blank. Those are the sections about functional loss after repeated use and during flare-ups. So I helped Mike file for an increase. At the next exam, with proper preparation, Mike explained, when I'm having a flare-up, which happens 2 or 3 times per month, it lasts 3 to 4 days, I can barely bend forward to 30 degrees. At the end of a workday, after lifting and bending repeatedly, I'm locked up at about 40 degrees. That examiner actually documented at that time. Mike's rating went to a 40%. That's an additional $584 a month. So over 30 years, that's an extra $210,000. Same injury, same pain, just a different exam. And it's a $210,000 difference. So what we're going to do today is make absolutely certain that when you go to your CMP exam, you get a complete evaluation, not a rushed one, not an incomplete one, a complete one. Okay, before we go into what happens during the exam itself, let's talk about what you need to bring with you, because preparation starts before you even walk in the door. Number 1, your symptom journal or your pain diary. If you watched my last video, you've started documenting your symptoms, your daily pain levels, what makes it worse, how far you can bend at different times of day, frequency and duration of flare-ups. Bring this documentation. Give it to the examiner at the beginning of the exam and say, I've been tracking my symptoms for the past month. I'd like you to review this as part of my exam. The examiner is required to consider lay evidence. That's your statement about your symptoms. Make it easy for them. Number two, a list of all your medications. Include the name, dosage, how often you take it, and whether it helps or not. For example, I take ibuprofen 800 milligrams 3 times a day. It provides minimum relief, maybe 2 to 3 hours. This shows severity and treatment history. Number three, bring copies of any recent imaging studies, x rays, MRI, CT scans. Even if the VA already has these, I would recommend bringing copies. Sometimes examiners don't have access to your full file or they don't take time to see it ahead of time. You want them to see that MRI showing degenerative disc disease or that x ray showing arthritis in your lumbar spine. Number four, a written personal statement. This is 1 to 2 pages describing how your back injury happened in service, your current symptoms and how often you experience them, specific functional limitations. I mean, like what you can't do anymore, how it affects your work, your daily activities, sleep, exercise, family life, a description of your worst flare ups, how often, how long, what you can do during them, and any secondary conditions you believe are related. You ideally want to upload this as a lay testimony personal statement with your file, but give this to the examiner on your day of your CMP exam as a prepared statement about your condition. And review this and include it in your report. Ask them to review it and include it in your report. Number five, and this one is very critical, bring a list of questions to ask that examiner. I'm going to give you a list of these questions throughout this video. I want you to start writing them down because if the examiner doesn't bring up certain topics, you need to. Don't bring family members into the exam room itself unless you've got prior approval. They're not going to allow it. Most examiners won't even allow it, right? But they can wait in the waiting room and you can have them write a buddy statement letter or later on too. So imagine you are prepared. Now you've got your documents. You walk into the exam. Here's exactly what's going to happen. Step one, the examiner should start by reviewing your medical records. They're supposed to review your service treatment records, any medical VA records, any private treatment records you've submitted ahead of time. Now, here's the problem. Sometimes they don't have all your records. Sometimes the VA didn't send them to them. Sometimes there's a computer glitch. So, the first question you should ask when you sit down is, have you received and reviewed all of my medical records, including my service treatment records and my recent MRI from XYZ date? If they say no, or they look uncertain, stop. Say, I have copies with me today. Would you like to review them now? And then hand them over to them. Because if they complete your exam without reviewing key medical evidence, the exam is inadequate. And an inadequate exam can be grounds for a new exam or a supplemental opinion. Section 1 of the DBQ requires the examiner to document what evidence they actually reviewed. So make sure they are reviewing everything. Step 2, the examiner is going to ask you questions about your medical history. This is actually section 2 of the DBQ. Here are the questions they should be asking and how you should answer them. Question 1, they're going to ask, describe the history of your thoracolumbar spine condition, including onset in the course. This is where you tell your service connection story. Be specific. Don't just say I hurt my back in the Army. Instead, say I was deployed to Afghanistan from 2012 to 13 with the 101st Airborne. I routinely carried 80 to 100 pounds on my rucksack for 12 to 15-mile patrols, sometimes multiple times per week. I also loaded and unloaded heavy equipment daily. I first noticed my lower back pain in March 2013 after a particularly long patrol where I fell with my rucksack on. I reported sick call and was given ibuprofen. The pain never resolved fully, and it's been continuous since 2013, getting progressively worse ever since. You see the difference? It's a specific unit, specific date, specific activity, specific incident, documented sick call visit, continuous symptoms since then. Question 2. Do you experience flare-ups of your thoracolumbar spine condition? This is critical. Your answer should be yes if you've ever had any flare-ups, and you need to be very, very specific about them. Here's how you should answer. Yes, I experience flare-ups 2 to 3 times per month. They're usually triggered by prolonged standing, lifting anything over 20 pounds, or yard work. When I'm having a flare-up, the pain goes from usually a 6 out of 10 to an 8 or 9 out of 10. I get severe muscle spasms in my lower back, and I can barely bend forward, maybe 25 to 30 degrees max compared to my usual 60 degrees. The flare-ups will typically last 3 to 4 days. During that time, I can't work, I can't exercise, I have trouble sleeping, and I need my wife's help with basic tasks like putting on my shoes and socks. I treat them with ice, heat, rest, and increased ibuprofen, but they still take several days to resolve. Did you hear all that? So you hear all the specifics I just gave? I gave frequency, 2 to 3 times per month, triggers and duration, 3 to 4 days, severity, 8 to 9 out of 10 pain, and specific functional limitations. You can only bend to 25 to 30 degrees. And what you can't do. It's like work, exercise, sleep, and basic tasks. The examiner is then required to document this. Now, Section 2B of the DBQ specifically asks for frequency, duration, characteristics, precipitating factors, alleviating factors, severity, and extent of functional impairment during flare ups. So if you say, yeah, sometimes my back flares up, that's not enough. We'll check the box yes and then move on. You need to force them to write down the details. So, question 3, do you report having any functional loss or functional impairment, including after repeated use over time? Again, your answer should be yes. And you need to explain why. Like, yes, absolutely. On a typical day when I first wake up, I can bend forward maybe 60 to 65 degrees before I experience significant pain. But after I've been at work for maybe several hours, I work in a warehouse, so I'm bending, lifting, moving all day. By the afternoon, I can only bend to about 40 to 45 degrees, and the pain is so much worse. By the end of my shift, I'm walking with a limp, and I have to use my back brace. When I get home, I can barely function at all. I gotta lie down for at least an hour before I can even help with dinner or play with my own children. On my days off, if I do yard work or work on my car, anything with repetitive bending, I'm locked up by the evening. The next day is always worse. So, see what I did there? You explained how your range of motion changes throughout the day with repeated use. You gave specific activities. You described functional loss, like you can't help with dinner, can't play with your kids. You showed that repeated use makes your condition worse. This feeds directly into Section 3C of that DBQ. Does procured evidence suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with repeated use over time? Most examiners will skip this section. Don't let them. If they don't ask about repeated use and functional loss, you'll need to bring it up. Okay, step 3 is the physical examination and range of motion testing. This is section 3 of the DBQ, and it's where the examiner measures how much you can move your back. They should use this device, a goniometer. It's basically a protractor with 2 arms. One arm stays stationary, the other arm moves with your body, and it measures the angle of movement. For thoracolumbar spine range of motion, you'll typically be static, and the examiner will align the goniometer along your spine, usually with the center point at about your hip level. One arm pointing down towards your legs, and they'll measure 6 different movements. They're going to measure forward flexion. You'll be asked to bend forward at the waist, try to touch your toes while you keep your knees straight. Normal, right here, 90 degrees, meaning your torso is perpendicular with your legs. This is the most important measurement for your rating. Now, if you can bend to 60 degrees or more, that's a 10% rating. If you can only bend between 30 and 60 degrees, that's 20%. If you can bend 30 degrees or less, that's typically 40%. So then they're going to measure extension. You'll be asked to lean backwards. Normal is 30 degrees. So straight up, leaning backwards. Lateral flexion, you'll be asked to bend to your left side and your right side, trying to slide your hand down your leg. Normal is 30 degrees on each side. And then you're going to do right and left rotation. You'll be asked to twist your torso to the right and left while keeping your hips facing forward. Normal is 30 degrees in each direction. Now, here's what's critical. The DBQ requires the examiner to document your pain too. Section 3 specifically asks, if noted on examination, which range of motion exhibited pain. And then, if any limitation of motion is specifically attributable to pain, weakness, fatigability, incoordination, or other, you got to note the degrees. This means if you can physically move to 70 degrees, but you stop at 50 degrees because of pain, the examiner is supposed to note that because pain limited motion matters for rating purposes. So here's how that goes. The examiner says, bend forward as far as you can. You start bending, and at 50 degrees, you feel significant pain. And you say, stop. You say it out loud. I have to stop here. The pain is too severe. The examiner should mark down 50 degrees and note pain limited motion. If they then try to passively move you further, meaning they gently try to push you farther, and you can physically get to 70 degrees, they'll note both measurements. But don't let them push you past the pain. If it hurts when they're pushing you, say stop. Say no, that causes me significant pain. I can't go further. You're not there to prove how tough you are. That was when you were in the military. You're there to show your functional limitations. The examiner should test you 3 times. This is section 3B, observed repetitive use range of motion. The DBQ actually states, is the veteran able to perform repetitive use testing with at least 3 repetitions? And then, is there additional loss of function or range of motion after these 3 repetitions? So they should have been bending you forward once. Let's say you get to 65 degrees. Then they have to have you stand back up and you do it again and again for a third time. If on that third repetition you can only get to 55 degrees because of either pain, fatigue, or muscle spasms, they're supposed to document that loss of function. But here's the reality: most examiners test you once and then they move on. They don't do 3 repetitions. So if they only test you once, you need to speak up. After the first measurement, say, aren't you supposed to test me 3 times? I typically get worse with repetitive motion. Force them to do it properly. The examiner should also check for localized tenderness. They'll press on different areas of your lower back and spine. If it hurts, say so. Yes, that's tender, or that causes pain. Muscle spasms. They should palpate or feel your lower back for muscles that spasm. Muscle spasm is a key finding that can actually support a 20% rating, even if your range of motion isn't that limited. And then you need to look for guarding. This is when you are unconsciously protecting your back, like bracing or tensing up during a movement. The examiner should note if they observe this. Then abnormal gait. They should watch you walk. If you are limping, if you walk stiffly, if you have an uneven gait, they should document it because muscle spasm or guarding resulting in an abnormal gait is one of the 20% rating criteria. If they don't check these things, mention them. Mention, I have constant muscle spasms in my lower back, or I've been told I walk limp when my back is bad. Step 4, this is when you do neurological testing. This is section 4 through section 8 of the DBQ. The examiner should test for signs of nerve involvement, which is what we call radiculopathy. Why does this matter? Because if you have nerve involvement, that's a completely separate rating from your lumbosacral strain. Radiculopathy can be rated from 10% to 40% per leg. And then they're going to look for things like muscle strength testing. The examiner should be testing the strength of your legs using a 0 to 5 scale. 5 out of 5 is normal strength, 4 out of 5 is active movement against some resistance, 3 out of 5 is active movement against gravity only, 2 out of 5 is activity movement with gravity eliminated, and 1 out of 5 is just a muscle twitch and no joint movement at all. And then a 0 out of 5 is when you have no movement at all, complete paralysis. They'll test things like Istobite, 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 Istobite. They'll test things like hip flexion. So lift your leg up while I push down on it. They'll test things like knee extension. So I want you to straighten your knee while I push against it. Ankle dorsiflexion. So pull your foot up towards your shin while I push down on it. Great toe extension. Point your big toe up towards the ceiling. Things like ankle plantar flexion. Push your foot down like you're pressing a gas pedal. If you have weakness in any of these movements, that suggests nerves involvement. So don't try to be strong. Don't power through this. If it's weak, let it be weak. And then they're going to look in section 5 at reflex testing. The examiner will tap your knee with a reflex hammer to test your patellar reflex and your ankle to test your Achilles reflex. They'll rate them as 0, which is absent, 1 plus, which is decreased, 2 plus, which is normal, all the way up to 4 plus, which is hyperreflex. Absent or decreased reflexes can indicate nerve damage. Hyperactive reflexes can indicate upper motor neuron problems, but that's probably not what's going on with radiculopathy. And then they're going to look at sensory testing in section 6. The examiner should test your sensation to light touch in different areas of your legs, like your thigh, your knee, shin, ankle, foot, and even toes. They're checking and testing what we call dermatones, which are specific areas of skin supplied by specific nerve roots. For example, the L2 to 3 nerve root supplies the front of your hip, your thigh. The L4, 5, and S1 supplies your lower leg and ankle. L5 supplies your foot and toes. So they'll lightly touch different areas and ask, can you feel this? Does it feel normal, decreased, or absent? If you have numbness or tingling in your legs, tell them. Say, my right foot is numb all the time, or I have tingling in my left shin. Next, they're going to do a straight leg raise test. This is a classic test for radiculopathy, especially sciatica. So you're going to lie on your back on a table, and the examiner will lift one leg at a time and will lift it straight up, keeping your knee locked until you feel pain down, that shooting pain down your leg. A positive test means the pain radiates down your leg below the knee, not just back pain, but shooting pain or numbness down the leg, down the butt and down the leg. That's a sign of nerve root compression. If you have sciatic pain, this test should reproduce it. So don't be stoic. If it hurts, Just say so. Say, yes, that's causing shooting pain down my right leg into my foot. Then they're going to do the radiculopathy assessment. So, based on all these tests, the examiner should document whether you have radiculopathy. So, remember, the DBQ is going to ask, do you have radicular pain or signs of radiculopathy? Indicate symptoms, location, and severity. Is it mild, moderate, or severe? Indicate the nerve root involvements. Is it L234 or L45S1, S2, S3? Which side is affected? Is it left or right? If you have shooting pain, numbness, tingling, or weakness in your legs, make sure the examiner knows, because that's potentially an additional 10 to 40% rating per leg. Okay, this is the section that makes me the most frustrated, because this is where examiners fail veterans typically the most. We've covered the basic range of motion testing. But remember, in my last video, I showed you that the DBQ has 4 different range of motion assessments. One is the initial range of motion, 2, range of motion after 3 repetitions and observed repetitive use, 3 is range of motion after repeated use over time, and 4 is range of motion after flare-ups. Most examiners will leave these blank. That's criminal, because those sections are where you can show that your 60-degree range of motion on exam day is not representative of your real world functional limitation. Let me show you exactly what the DBQ says and what the examiner is supposed to do. So in section 3C, the repeated use over time, the DBQ specifically asks, is the veteran being examined immediately after repeated use over time? Most of the time, the answer is going to be no. They're not being examined right after an 8-hour work shift or doing yard work all day. And then the next question, does procured evidence, meaning statements from the veteran, suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with repeated use over time? This is actually asking, based on what you've told them and what's in your medical records, does your range of motion get worse with repeated use? Then it says estimate range of motion of the joint after repeated use over time based on the procured evidence. So that's from your statements. They don't have to directly observe it. They have to take your word for it, combined with their medical expertise, and then estimate. So here's what you need to do. If the examiner doesn't ask about repeated use, you bring it up. Say something like, hey doc, I want to make sure you document my functional limitations with repeated use over time, which is, I know, a requirement in section 3C of the DBQ. Today in this exam room, I was able to bend whatever your measurement was, but that's after resting in the waiting room for 30 minutes. In my real life, after I've been working for several hours, lifting, bending, standing, my range of motion is significantly worse. Based on my daily experience, after repeated use over time, I can only bend to about, I'm going to estimate your degrees, and that limitation significantly affects my ability to work and function. Can you please document this and provide an estimated range of motion for repeated use over time as the DPQ requires? You've just done 3 things there. You've cited the DBQ by section number, showing you know what's required. 2, you provided specific functional information. And 3, you directly asked them to complete that section. It's much harder for them to skip it now. What about section 3D flare-ups? Same thing. DBQ asks, is the veteran examined during a flare-up? Probably not. Most people aren't scheduled for exams during their worst days or their worst symptoms. So the question then follows, does procured evidence, like statements from the veteran, suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with flare-ups? So estimate range of motion in degrees for this joint during flare-ups based on information procured from relevant sources, including the lay statements of the veteran. Again, they are supposed to estimate your range of motion during flare-ups based on your description. So you say, hey doc, I also need you to document my range of motion during flare-ups as required in section 3D. I experience flare-ups, how often, lasting for how long. During these flare-ups, my range of motion is significantly more limited than what you just measured today. During a flare-up, I can only bend forward to approximately estimate the degrees because of severe pain and muscle spasms. Can you please document this and provide an estimated range of motion during flare-ups? You see how powerful this is? You are taking control of that exam. You're ensuring they complete every section of the DBQ. And here's the thing, if they refuse, if they say, I can only document what I directly observe, that's a red flag. The DBQ instruction specifically tells them to provide estimates based on your lay evidence. So you can politely but firmly respond, listen, I understand, but the DBQ instructions in section 3C and 3D specifically require you to estimate range of motion during these conditions based on my statements and medical evidence. I'm providing you that information now, and I'm asking you to complete those sections as required. Be respectful, Don't argue, but hold your ground and be firm. This is your exam, your rating, your benefits. Now, let me bring all this together for you. Your CNP exam is the single most important factor in your lumbosacral strength. It's not just about how far you can bend in one particular day, it's about capturing your complete functional picture, including how you function during flare ups, after repeated use with neurological symptoms, and in your daily life. The exam should include a thorough review of your medical records, detailed questions about your history, flare ups, and functional limitations, range of motion testing with at least 3 repetition, pain documentation during range of motion testing, neurological testing for radiculopathy, and most critically, documented estimates of your range of motion during flare ups and after repeated use over time based on your statements. But here's the reality: most examiners skip the most important parts. So you have to be your own advocate. You have to make sure that they write that down. Bring your documentation, ask the right question, make sure they complete every section of that DBQ. And if the exam is inadequate, take action immediately. Don't wait until after you get a low rating. This device, the
This device.
goniometer, measures angles, but your disability rating shouldn't be based only on the angle you can bend to on one good day after sitting in a waiting room. Your rating should reflect your worst days, okay? So your flare-ups, your functional limitations after a full day of work, the activities you can't do anymore, the pain you live with every single day. And the DBQ is designed to capture that, but only if it's completed properly. Remember those two veterans from the beginning? Mike got 10% from an incomplete exam. After I helped him prepare for his re-exam and ensured every section was documented, he got a 40% rating. Remember, that's a $210,000 increase over 30 years. Same back, same pen, different level of preparation. Now, I know some of you are watching this and thinking, this is overwhelming. So much information. I don't know if I can remember all this during my exam. I'm not good at advocating for myself. I get nervous. I get it. I get it. That's why we created Xterra Health. We specifically help veterans earn the benefits they deserve through expertly created next letters and DBQs. We take the pain out of it for you. We will review your medical records beforehand free of charge. We help you document your flare ups and functional limitations because you shouldn't have to be a DBQ expert to get a fair rating. You shouldn't have to know all these technical requirements. You served your country, you earned these benefits, and you deserve someone who's in your corner who actually understands the system. So if you want help with your lumbosacral strain claim, visit xterrahealth.com. The link is in the description. And schedule a free consultation today. We will
Device.
review your case and tell you exactly what we can do to help. Now go schedule that consultation. Again, it's xterrahealth.com. And review your notes from this video and get ready to advocate for yourself at your CMP exam. So thank you for watching. Like, subscribe, turn on notifications, stay strong, and until next time, stay mission ready.